Welcome to Business World Healthcare. On the occasion of the World Brain Day, we have with us Dr. P.N. Renjen, who has more than 36 years of experience in the field of neurosciences. He is a fellow of the American Academy of Neurology and is an elected member of the National Academy of Medical Sciences. He has published more than 75 scientific papers in national and international journals and has also written many chapters in various books. His special interest is vascular neurology. Dr. Renjen is also the nominated member of the European Stroke Association. At present, Dr. Renjen is a senior consultant neurologist and advisor academics at the Institute of Neurosciences in Indraprastha Apollo Hospitals in New Delhi. Good morning, Dr. Renjen. Welcome to Business World. My first question to you is, how does one know that the person has a problem or could have a problem in the brain? When is it that the person should get the brain checked?
Thank you very much and good morning. And thank you very much for asking me to be here today. Your question is, when do you suspect that one has a brain disease? Now, really, the suspicion is a bit difficult, I would say, because the brain has a lot of capacity to, adjust to the surroundings, to the milieu that it is in. And number two, the brain symptoms are not standard for a disease. It is standard for a different disease. Say, for example, if you have a stroke, the symptoms of stroke sometimes are so mild that they tend to be ignored. For example, if a patient has what is called a TIA, a transient ischemic attack, which I use the word an angina of the brain, the patient runs to the cardiologist if he has pain anywhere in the chest. But if he gets some tingling, numbness on one side of the body, difficulty in walking, clumsiness, double vision, he ignores it because in half an hour, it clears up. So really the symptoms of the brain, one has to be really, really aware and see the doctor immediately before the symptom produces frank neurological deficits.
So my second question may have an overlap with the first one, but I still would want to ask because this is something which is very commonly not so easily understood by our audience. What are the most common brain disorders that may be overlooked or may remain undiagnosed?
See, the brain disorders depends on the age of the patient. And the commonest disorder in the elderlies, which gets overlooked, is memory disturbances, the cognitive function. One always tries to find an excuse for everything. You have a very early, recent memory disorder. You would say, "Arey, ye to hota hai. This is with age. If with age you tend to forget." The family say, "Don't worry, this is with age." So I think in the elderlies, the common disorder which is ignored is a memory disturbance. Patient, by the time he ends up with us, has already developed a frank cognitive memory disturbance. What I would like to stress here is that memory is only one function of the brain. You have judgment, you have orientation, you have language. So you may not necessarily have a memory disturbance. You could have a language function. You could be just disoriented. Very often patient comes and tells you that he doesn't know where his house is. He misses the house. So these are all functions of memory, which get ignored by the time the patient realizes there's something more serious.
Dr. Renjen, what do you think are the possible reasons of the lack of awareness on brain disorders. Like you yourself mentioned, if somebody has a pain in the chest, they run to a cardiologist. But when somebody faces a memory loss or certain very small signs of a possible brain disorder, they just ignore it. Is there a reason for this lack of awareness on these disorders? Or is it just that there's a societal stigma attached to the role that plays a role in the same?
I think you asked a very nice question. And how I would answer this is that the brain, poor thing, there are lots of myths and misconceptions. Now, I'll start off with the thing which I'm interested in, is stroke. It is very difficult even to convince people today that stroke is treatable, that stroke is preventable. Please come early to us, we'll give you back a normal person. The misconception that you should be in the house, you should use oils, you should use pigeon blood, and all that is still there. Those misconceptions are there. That's number one. Number two, what you rightly said was that if I tell somebody that I have got a brain disorder, the first thing would be he would be labeled as a pagal. Now, if you tell somebody that my father or mother has developed a progressive loss of memory, then it will be, oh, very bad. You know, there's no cure for all this. Most of the neurological disorders have no cure, and you know, he's going to be bedridden. So I think what you said was a very, very appropriate thing. Still, in 2022, it's very difficult for us neurologists to still convince people. When I tell people the stroke is treatable, stroke is preventable, please come in time to me, I can help you out, they would say, I'm just talking some very good shit. You know, so this is really the problem with neurological disorders.
Dr. Renjen, that brings me to the next question. I mean, you mentioned the word prevention. The whole world is talking of prevention, especially after the pandemic. Now, my question to you is, how can one check if the brain is healthy? I mean, like we go for a preventive checkup every year. Is there some kind of a checkup to find out if your brain is still healthy without having any symptoms?
Well, that's again a very good question. See, we have started a stroke checkup in our hospital, which is the part of the health checkups we have. No, you're absolutely right. That can I say looking at an MRI, or can I say looking at a CT, that your brain is normal or abnormal? Absolutely not. You have a patient who has an advanced dementia, his MRCT may be normal. So I think the diagnosis of brain disorders still has to be clinical and clinical and clinical. Is what you come and tell me, what I listen to you. Then only I can say, yes, you require to have a PET MR or whatever you may require. So I think the doctor has to spend a lot of time with this patient to really know whether he has a neurological or an organic brain problem.
Now the question is more towards childhood brain disorders. Now, it's a very touchy topic for a parent when somebody tells them that, iska test karaya ya iska dhyan rakhiyega. So are the childhood brain disorders on the rise? And if they are, what could be the cause? And what are the early signs that the parents could watch out for them to be alarmed?
See, the childhood disorders totally different from the adult disorders. That's one. Child neurology, it is not that a child has the same disease which is adult has. So child is a totally different by itself, metabolically, biochemically, everything. That's number one. The thing which I would like to stress is a treatable, curable to some extent, a childhood disorder called epilepsy? Well, still, again, the same thing, stigma in the house, stigma in the school. We conducted a small study, we went to the schools and tried to find out from the teachers, do you know how many children, or have the parents ever come to you and told you my child has epilepsy? The answer to that question by a very senior principal and the teachers, not even a single one. Then we asked the parents, what was the reply? Doctor, if I go and tell that this child has epilepsy, he will be isolated, which is very unfortunate. Epilepsy is a treatable disorder in 75%, except what you rightly said. You got to diagnose the right epilepsy, start the right drug at the right time. 75% of the children would get control with a single anti-epileptic therapy. So it's all that is there. And epilepsy, the incidence of epilepsy is increasing. The incidence of epilepsy is more in rural than Indian population. And most importantly, the parents hide. That my child has epilepsy, because they think that it's a stigma. If I tell anybody, my child will be sort of taken away from the normal course of his growing. So I think that is a very, very, very common problem in children.
So, what are the early signs of a brain tumor?
Well, see, the signs of a brain tumor depend basically on the site of the tumor. See, in the brain, you have the upper part of the brain and a lower part of the brain. The upper part of the brain is called supratentorial. The lower part of the brain is called infratentorial. The signs and symptoms of a brain tumor would be different from upper part of the brain than the lower part of the brain. Adults are more prone to get symptoms in supratentorial. Children get more commonly in infratentorial. So it depends on the size of the tumor. It depends upon the site of the tumor. It depends how fast the tumor is growing. Now, if you have a tumor, for example, in the frontal lobe, and as you know, frontal lobes are lobes for judgment. Our executive functions are by the frontal lobe. The brain is such a capacity that these patients of frontal lobe tumor do not develop any paralysis. They just develop a change in personality. And as we very rightly said, if you have a change in personality for a person who was a very calm person, suddenly has become very, very hyper, it's not normal, but it is very difficult for the family to interpret that a change in behavior is not a normal situation. So one of the causes is behavior changes, memory loss, paralysis on one half of the body. See, by the time the paralysis comes, the brain tumors are already quite big. They are present on the motor cortex. Another important manifestation is epilepsy. We use the word late onset epilepsy. Any epilepsy which begins after the age of 25 years is not idiopathic. That epilepsy needs to be investigated to rule out the underlying tumor.
Dr. Renjen, memory loss, as you have also mentioned, is one of the most common brain-related ailments. Now, why and how does this happen?
Well, again, there are two things. We now use the terminology called MCI, mild cognitive impairment. MCI is not dementia. MCI is a prelude to dementia. MCI usually is not associated with severe memory disturbances. So, you could have a patient of a stroke, which is, we use the word vascular MCI. And these vascular MCI at times can go into a frank dementia. So really, dementia is not a disease. Dementia is a symptom of an underlying disease. You could have a dementia because of a stroke. In my own study, 25 to 30% of patients who have a stroke at the end of 3 months develop memory disturbances. You could have a dementia because of Alzheimer's disease. You could have dementia because of number of other cognitive degenerative disease of the nervous system. Last but most important, which you will ask me, is dementia associated with COVID?
Is it, sir?
You want me to talk about COVID?
Absolutely, sir.
Well, see, we have seen a lot of patients coming to us weeks after the COVID is over with lack of concentration, restlessness, unable to sleep, unable to concentrate. Now, these are people who have been pre-COVID time absolutely normal. One thing which I more saw was, if a patient already had an underlying memory loss of any type, post-COVID period, it becomes worse. So there could be two groups which could behave differently. One, we already had a memory loss, then had COVID. The others, who were comparatively maybe younger, 45, 50 years, developed a memory loss. Now, I have very commonly seen a terminology, not that I use, is what is called fog states, FOG. Now, you know what happens if the family says and comes, Doctor, he's just confused. He doesn't know where he is. At times he talks, so he is in a confused state of mind. Now, what is the cause of this fog state? Is it related directly to COVID? Or is it related to some complications of COVID, like vascular complication? As you also very well know, that the incidence of stroke we have seen has increased in the post-COVID period of people who have COVID. Now, how do you treat these fog states, lack of concentration, not able to sleep? It's only to wait. I tell them, take lots of water to drink, no medicines, take some vitamins. And if the patient is very, very restless, I may give a benzodiazepine, otherwise nothing. And obviously, most of the time, they're self-limiting. But again, they carry caveat here. The caveat is that if he was already having a memory disturbance in the pre-COVID period, then he may not get back to normal that early. And some amount of memory state, some amount of fog state may persist.
Sir, very interesting that you brought up this COVID thing. Now, a lot of people have stayed back home. They've had issues related to their jobs. They've gone through a lot of planned grief. And I mean, they've gone through a lot. And a lot of people are saying that there are mental stresses that people are going through. Now, how does one differentiate between the medical side of it, saying that it could be a brain disorder, versus somebody thinking that, they need meditation, etc.? Because that's the first thing that people are now going in for.
I think, again, it's a damn good question that, all of us have been in the houses for 2 years. And first and the foremost thing I would say is that if a person had lots of hobbies, they did not develop any of these problems like the person sitting in front of you. I am very fond of reading. So the 2 years period, I read such good books which I would have never read. Discovery of India was the book which I read. I read most of the classical novels because I enjoyed reading it. I learned a lot of music. So people who are extroverted, people who know how to utilize their time, they did not have many problems. You were right in saying that group of people was sitting in the house for 2 years, nothing else to do except watch the television, the show of Mr. Sharma, or something of that sort. They all had a lot of problems. Now, how do you really say that these were just depression, withdrawn behavior, or it was dementia, or a lot of people did develop dementia, depression also? You're right in saying that it would be a Herculean task, but I suppose it should be very difficult on subsequent occasions to assess whether they have an organic problem or they have a functional problem. As you know, usually we say functional psychosis to the word organic psychosis. Functional psychosis is depression, introverted behavior, sitting in the house, and an organic is that you have developed a dementia or the underlying depression.
Sir, you mentioned about the fog situation. There was a term that you used. Now, there are people who are talking, they're having a conversation, and in the middle of the conversation, they lose their track. They come and tell you that, I don't know, whatever they're saying, I've lost the track. So could that be also falling into this category of the fog situation?
Certainly. See, the point is that this is what is called, they cannot put their thoughts together. So, they have got, that's what sometimes called a formal thought disorder. And that is, of course, a very important symptom of a psychosis.
Right. Now, sir, when we look at the brain disorders, suddenly we find that they're on a rise. Is there a reason, or is it just that there are more of those cases detected because people are now going in for tests, or is there a reason why they are on the rise?
Again, it's a very pertinent and a very good question. Well, I would say yes, to some extent, the brain disorders are on the rise. And I would also say that better diagnostic facilities, availability of better healthcare, more so better availability of healthcare in the private sector, that more and more brain disorders get diagnosed. Very simple, I'll give you. Now, stroke, the incidence of stroke, cerebral stroke in our country has gone up. Why? Because of three very common reasons. The incidence of stroke in the developing world is coming down. The incidence of stroke in the developing world like I is going up. Why is it going up? We have not been able to look after diabetes, hypertension, hypercholesteremia, lifestyle-related diseases. After stroke, cancer, they're all lifestyle-related diseases. That is why the incidence of stroke is steadily rising. So I would say, yes, there is an incidence of stroke, which is about 240 per 100,000 population, which is 60 to 70 in the developing world. So that is very clear. And number two, I give you an example of comparatively rare disease, multiple sclerosis. It's called a demyelination of the brain and of the spinal cord. We thought 10 years back, there is no multiple sclerosis in India. There were lots of articles. Is there multiple sclerosis in India? The answer to the question, again, there is. Why? Because more people come to us. We have better MRI facilities. More people get diagnosed. So I think neurological disorders are getting more diagnosis and they're getting their worth. A stroke patient is getting more of his worth than he ever got 20 years back because the awareness is increasing. We have got the risk factors of stroke. They are modifiable They're non-modifiable. If you have diabetes, hypertension, hypercholesterolemia, I can help you to prevent a stroke. The non-modifiables are only two: sex and genetics. I can't change your sex. Genetics is genetics. So that is why I say that there is such an increase in the neurological disorders in our country.
Now, sir, when it comes to Alzheimer's, is there a way to have an early detection of Alzheimer's? And how would you differentiate Alzheimer's from memory loss?
See, this question I am asked by all my patients. It's very difficult for for me to come and say, if I have a patient who comes to me with 2 months of loss of memory, recent memory, the family says he forgets telephone number, he repeats the same thing, he doesn't remember what he had for breakfast. Can I call this Alzheimer's disease? I cannot. See, all these big terms of Alzheimer's, frontotemporal dementia, Alzheimer's dementia, they are all a part of an underlying degenerative disease. And you know something, that Alzheimer's is very slowly progressive. It may take up to 2 to 3 years for you to say it's a frank Alzheimer's. So if you're talking about a memory disturbance, you are talking about trying to find out the cause of the memory disturbance. Now, again, you'll ask me the question, the next question would be, how do you distinguish between the various types of dementia? Clinically, difficult, yes. If you do psychological testing or a psychometry, the psychologist can tell you these are the lobes which are affected. Suppose you have bilateral temporal lobe involvement, then you will say it is more an Alzheimer's dementia. I, for one, in my practice now, try to delineate a dementia as much as possible because the family wants a prognosis. And I know there are certain dementia which are treatable and curable. So if you don't mind, I mention the types of dementia which are not degenerative, but which are treatable. If you have heavy intake of alcohol, that dementia is treatable. If you have a deficiency of vitamin B12, it is treatable. Dementia associated with thyroid disease is treatable. If you have a dementia because of a brain tumor, it is treatable. If you have a dementia because of what is called an NPH, a normal pressure hydrocephalus in the brain, it is treatable. So when a patient comes to me, my first job is treatable, non-treatable. If I can treat a dementia, I have done a lot. If it's a degenerative dementia, then obviously my next, or what I do is, I try to find out whether it is Alzheimer's or not. And we have now investigation available, which is called PET-MR. MR and PET put together reasonably good to the diagnosis of the type of dementia. And I don't treat a dementia till the time or as far as possible I know what I am treating.
That's brilliant, sir. Dr. Renjen, there's a lot of workload which is increasing and the stress levels have gone up in the workspaces and I've even had in personal lives. Headaches are on a rise. Now, how can one cater to this without an intensive medication? And does taking medication for a long term lead to bigger problems?
Well, again, see, the headache is one of the most common OPD diagnosis which we have. And how I approach a headache is, as you very rightly said, no over medication, no over investigation. Both of them are not right from the patient's point of view because these investigations have become so expensive. My attitude is that if I have a headache patient, male or a female, at the age of 20, 25 years is different. If I have a child who comes to me with headache, it's different. If an adult of 60, 65 years comes to me with a headache, it's different. If a child has a headache, I'm worried. I would certainly do an imaging to rule out the tumor. If a young girl comes to me at 20, 25 with a headache, what I would do is see whether it is a migraine. Migraine is a common type of headache. The migraine is overdiagnosed. Migraine is underdiagnosed. Any patient who has a headache on one side is called migraine. It's not migraine. Migraine is a very specific symptomatology. Unilateral, busting, headache associated with visual problems, vomiting, patient gets all right, is a typical migraine. You may not get typical, you may get atypical. So if I have a migraine, I treat. But most importantly, in the working class, there's a lot of stress headache, tension headache. Now, what I do with my tension headaches is I tell them to please forget all medicines, start doing yoga, start doing some meditation. And I think yoga really is great in people who have a tension headache or who have a muscular contraction. Especially people with migraine also have a lot of stress. Their stress is, if it's a young female, poor things get a headache, she has to go to office, she has to work in the house, and I'm sure this husband grumbles that all day long you're having a headache, so they also get stressed. I tell them to do yoga, meditation, take walks, and relax. Your headache will come down, and really does help. Anyways, very rightly you said, giving them medicines is only one part of migraine. And every migraine, as I said, suppose you come and tell me that I get a headache once in a month. What I would do is, I said, don't take any medicines. Only when you get the headache, take this medicine and you'll be okay. Why should you treat it? Yeah, if a 60 years old man comes to you with headache, straight away he goes for an MRI because his headache could be because of a tumor, his headache could be because of a brain clot, headache could be because of hemorrhage or anything. So my attitude towards hemorrhage is absolutely balanced. And I treat, investigate, I don't investigate everybody. And sometimes people ask me, you don't investigate, you will miss. I said, what will happen if I miss 1 in 100? I'm not that stupid a clinician. I'm a reasonably good clinician to say, yes, in 1 in 100, I may miss something. That's all right.
Absolutely, sir. Now, since we spoke about prevention at one stage, now how can one keep their brain healthy? Are there some exercises or are there some things that people can do on regular basis to keep their brain healthy?
I can tell you how I keep my brain healthy. And my brain is pretty healthy till now at my age. Now, it's a very good question again. First, do regular physical exercise. 2, eat healthy diet which has a lot of antioxidants. I always talk about antioxidants, and I just like to stress, if I can take a minute, antioxidant, normally body produces some amount of antioxidant because we all are under oxidative stress. Diabetes, hypertension, tension, anxiety, they all produce antioxidants. And the best source of antioxidant is diet. Vitamin C, selenium, vitamin B12, they all are antioxidants. So take a good, healthy diet. It is always not necessary to have a non-vegetarian diet. You could have a combination of vegetarian diet and a non-vegetarian diet. Number 3, what is important is continue to read and work. I'm always reminded of, I met him only once, Dr. Pushpendra Singh. At the age of 92, the gentleman was as it is still clear as a 25 years old person would be. Because why? He utilized his brain, he kept on reading, and then the last thing is, if you are an introvert, then obviously I am pretty sure, and I have seen that you develop dementia later than a guy who's an introvert, anxiety, depression, sitting in the house will develop dementia fast.
So before I end this conversation, I want to ask you if you have a message for the World Brain Day.
My message for all the listeners who will have listened or will read about it, keep your brain active. As we have rightly discussed, keep your brain healthy. It is not at all difficult, but certainly you can prolong and improve your quality of life if you keep your brain healthy.
Sir, thank you so much for your time. I'm so glad that we had this conversation. My biggest takeaway is that, while we are worried that, you have more cases of brain diseases coming to light, it is also a sign of people becoming more aware. So while the awareness has increased, I think, like you mentioned, there is still miles to go before we can say that, now the world can be a better place. So let's keep our efforts on. I thank you.
Thank you so much.
Thank you so much, sir.
The pleasure. You asked some lovely questions.
Thank you, sir.